Hey, and welcome to the lecture. Before we jump into the learning, just a quick reminder to check out the workbooks available on modernoptician.com through the Ultimate Apprentice Optician Study Guide or available on Amazon worldwide. It's the best way to accompany this lecture so that you can fill in the blanks, label the diagrams, do everything all concurrently, and elevate your training to the next level. All the links to the workbooks and the website are all in the description down below, so make sure to check it out. Other than that, enjoy today's lesson.
All right, so we talked about medications that affect the eye, and we talked about how you don't have to worry about it so much. Just understand that there are external factors that can affect how people see and how you're essentially going to handle their vision. Now I want to talk about diseases that affect vision, namely mostly systemic diseases that aren't necessarily ocular diseases, but they have implications on vision. This is far more important because um, you have to treat the patient as a whole. They're not just a set of eyes. They have all the other systems in their body that are all interconnected in some way, and therefore understanding their systemic conditions is going to give you some insight as to what to expect with their vision, and also going to help you understand when things are not working appropriately. There could be external factors, meaning it could be due to systemic conditions and out of your control. So, very important stuff. And again, I'm going to iterate that this is something that I wish was done better in our field. I wish that we as opticians had much easier access to the patient's file and history of systemic conditions because it would help us do our job better, understand when things are going wrong, why it might be going wrong, and not lead us down this rabbit hole of looking and checking of all the things that we think we may have done wrong when in the grand scheme of things, we may have done nothing wrong. Anyways, maybe one day we will achieve all of this. However, for the time being, we could just learn and be better, and hopefully everything kind of works itself in the end. All right, so the first one I want to talk about is hyperthyroidism. Okay, so that means there's an overactive thyroid gland. Now, patients may present with a variety of ocular findings, right? This includes lid retraction, periorbital and lid swelling, chemosis, conjunctival hyperemia, proptosis, optic neuropathy, restrictive myopathy, exposure keratopathy or keratoconjunctivitis sicca. Mini sclero or sclerolensi may be the best option for the management of irregular or regular corneas and in the and in the therapy of ocular surface disease. Wow, that was a mouthful. All this to say, if a person is suffering from hyperthyroidism, there are major ocular implications. Okay, things that you're going to notice just from my experience. Okay, things that you're going to notice for these people: lid swelling, very common. Okay, proptosis, where the eyes are bulging, very, very common. Things like optic neuropathy and stuff like that, you're not going to see. However, they will talk about it. Keratoconjunctivitis sicca, and a lot of this has to do with the fact that if the eye is propped it out and there's lid retraction, the cornea can't be healthy. Anyways, at the end of the day, if your patient is suffering from thyroid conditions, uh, it definitely has major ocular implications. Okay, um, sometimes the ways you're going to be able to tell is if if they're taking medications like levothyroxine. You also see things like L-troxin. These are all medications, Synthroid. These are medications that affect that are used to treat thyroid conditions. Then just know in the back of your mind there could be some ocular components. All right. Common issue that is linked to thyroid conditions is Graves' disease. Okay, and all these symptoms are associated. We mentioned with the proptosis and all this very closely linked to Graves' disease. All right. So this Sjogren's syndrome is another condition that you need to be aware of. It's an autoimmune disease or disorder that attacks and destroys glands responsible for keeping the eyes, mouth, and other parts of the body moist and lubricated. So they're basically dried out. Advanced form of this pathology are a definite contraindication to contact lens wear due to the risk of ocular surface damage and ulceration, right? So, and this applies to all the diseases we're going to talk about. But with hypothyroidism and Sjogren's disease, I certainly hope the patient will mention it to you, because it's important to know, right? The only problem is that once they reach the dispensary, especially if your dispensary has a really retail feel, the patient tends to forget that they should be mentioning things about their systemic health. So, hey, all the more reason to not be too retail and have a little bit of a clinical feel, because you may be missing out on really important information. However, Sjogren's syndrome, basically extreme dry eyes, and is very difficult to manage and can be very difficult to get proper vision because of it. So that's important to know. So we talked about diabetes. I just thought I'd drop it in there again. One of the most common systemic diseases, affects the retina. Definitely something that you always have to be aware of. So again, um, short of doing medical history checks of yourself, there's got to be a way that you got to find to be able to be aware of what kind of systemic diseases people are having. Often diabetic patients will divulge that, however, not always. So, whatever you can do to be better at, learning information about your patient, all the power to you. Rheumatoid arthritis, inflammatory, right? So if rheumatoid arthritis is an autoimmune inflammatory disease that usually targets the joints, but can also lead to things like dry eyes, scleritis, uveitis. So, these are all things that we need to be aware that even though you're not going to be treating these more acute conditions in the moment, patients who suffer from dry eyes obviously have visual problems and comfort problems. Patients who've had scleritis or uveitis can also have detrimental scarring and issues. So, if your patient has rheumatoid arthritis, there are ocular implications that you should keep in the back of your mind. HIV/AIDS. We don't see it, daily. However, it is something that, in your career, you will encounter patients who have this autoimmune disorder. And it's not, for example, a direct contraindication indication to contact lens wear. However, the patient can be more prone to infection if the disease is advanced. Sorry. Um, and you have to take strong precautions, right? Just for being clean and careful. I've had a few patients who've had contact lens patients who've divulged that they have HIV or AIDS, and we take extra precautions. We clean up, and we should always be cleaning up, and especially ever since COVID, we've gotten even better at cleaning. However, you always have to take precautions. Watch for open wounds and things like that, and you watch for transmission. Remember, you can't transmit through saliva and tears. However, you still want to be careful, right? So these are diseases, like I said, that we should be aware that these systemic diseases, there are more. However, these are primary ones that we should always be aware of, have some kind of implication to vision and to ocular health and to our jobs, right? So again, significance, well, you don't have to be an expert in disease, but you need to be aware that there are certain diseases that have ocular implications, and the better you are at this, the better you will be at your job, right? And the easier things will be, because the more knowledgeable you are, the more things flow and are easier, and you spend less time trying to figure out the problem, especially if you were going down the wrong path without knowing this kind of stuff, right? Don't be afraid to ask patients their medical history. You are, after all, a healthcare professional. There's this huge apprehension about asking people about their stuff. And I don't understand it, because, you have to be discreet, right? You don't want to be like blurring it out. And I know we're all, not always in a really private environment. Sometimes I will pull people into the contact lens room, or I'll pull people aside and ask them things if I suspect that there could be something else going on that can help me advise them better and that can help me do my job better. You should not be afraid of this, right? I have students all the time who have a problem, and I say, well, did you ask them about this, this, and this? And they look at me like, well, I don't have the right. Of course you do. You are an eye care professional. Their medical history and their systemic history is all part of it. So don't be afraid. Ask. It does take a little bit of skill, a little bit of practice, but the earlier you do it and the more often you do it, the better you'll get at it. All right. And keep to ocular implications. Um, what was I trying to say here? Keep to ocular implications. Well, let's just make something up here as what I think I was trying to say, meaning you have to stick to systemic diseases that have ocular implications, I think is what I was trying to say. If you're going to be asking people about all sorts of systemic stuff, stick to the stuff that's going to have some kind of ocular implication, and try to remember all these different ocular implications that relate to the systemic one, so that you have a path, because you don't want to be just bouncing all over the place. you have to have this idea of what could be the cause. And if you aren't sure, definitely confer with the doctor or refer to the doctor. If you think that certain ocular implications are having an effect, sorry, if certain systemic conditions are having an effect on the eyes, then you should confer and refer and consult so that you can be on the same page and understand, because once again, this is all about not going down the wrong path and giving people the best care possible. All right. I hope you enjoyed this one. I think you understand now, that there are systemic and ocular links, and it's important for us to understand them.